right? We begin to really clearly differentiate different types of sensation in our body. One of the first things that we have to learn how to do is differentiate pain, real pain, that's damaging the body, from intense sensation. And sometimes we feel an intense sensation and our body doesn't know how to classify it, and so we feel that it's pain, we're endangering our body, and we eject ourselves. We check out mentally, or we get out of the pose as quickly as we can, right? So one of the things that you have to do, the first thing that you should do when you experience those sensations is, first thing you do is you back out a little bit. You don't jump out of the pose. You don't push yourself through it. You back out a little bit to where the sensations are tolerable, right? Then you begin to re-enter that zone where you're starting to feel those sensations in a way that you can begin to discern, is this hurting me, or is this just intense sensation? You go to the point where it's tolerable. You never push forward beyond that, right? We have a tendency to be in a perpetual state of reaction, and we're trying to find a state where we can make intelligent choices about what action to take, right? So that's the first thing. You have to begin to take yourself out of the reaction cycle. We talked about some of the reasons why we might get some of these intense sensations. There's several things. Some of them are good, some of them are bad. Misusing a joint will cause pain that is damaging the body. Or using the wrong muscle to do more work than it's intended to do will cause pain that is damaging the body. However, if you have a muscle that has not been used, that should be used, and it is atrophied, the first sensation that you'll often feel as that muscle starts to become, you start to become aware of that muscle, is an uncomfortable sensation, an intense sensation. So you have to be aware, is this something coming back to life? Are you getting a cramp because there's blood flow into an area that hasn't previously had blood flow? Or am I hurting myself? Another thing is scar tissue. We all have old injuries in our body from the loving use that we've used throughout our life thus far, or trigger points, ways that we have used our body that have maybe caused some injury in the past. And our body, even though the injury heals, sometimes our body reorganizes itself in a way to compensate for this injury or for this scar tissue that's laying in our body. And so scar tissue is kind of like crazy glue. If you tear a tissue, your body's response is to secrete this chemical, and it's like crazy glue, and it's not clean. It doesn't fix, it kind of lays down cross fibers, right? And sometimes it adheres not just muscle to muscle, but two muscles that should be moving separately get adhered together, or the muscle may get adhered to the bone as well. So sometimes when we start to create lines of force along the muscles, those adhesions begin to tear apart. And that's a very healthy process because you're bringing back your range of motion as it was originally intended. But it can sometimes be a painful process, right? So you have to begin to discern what's good and what's bad, and you need to learn about your body. If you don't know how to use your body properly, it's better to err on the side of caution until you figure it out. And as I said, by going through this practice mindfully, you will begin to learn. Remember that homunculus I talked about, that image in the brain of what the body should look like? You'll begin to fill it in more and more. You'll begin to get an internal sight of what your body looks like based on the sensations that arise from your practice. And you begin to go through it safely. 2 guidelines are that you should always have your bandhas in place. You should always be breathing deeply and evenly. If those 2 things are there, you are usually safe to go into, or to push yourself a little bit further into a pose. As soon as you feel your bandhas let go, or your breath start to either hold or get very quick, then you know you're pushing yourself a little too hard.